All right, thanks, Bear. Thanks, Tamsin. Once again, Esno, I suppose, proves to be on top of many important issues. And with such a campaign, I think we're all looking forward, hopefully you as well, to participate in some way or the other. Halfway, let's move from Europe via leadership and the Esno campaign for the next years to what is referred to as today as health arrivals. In this session, we will have two speakers. I will introduce the first speaker, and then I will invite the first speaker to present, and after his presentation, I will present the second speaker. So the first speaker then is Luigi Apuzzo. Luigi is a collaborative professional health nurse at CPS, Nurse National Agency for Regional Health Services and Health Workforce Planning, AGINAS in Italy. And Luigi is gonna talk about task shifting, and task shifting has very briefly been introduced by Maya Matthews, I think, as a very important strategy to deal with some of the important workforce issues. So Luigi, the floor is yours.
Okay, thank you, Bert. Hello, everyone. Okay. I'm going to share with you my short presentation on task shifting. And as we have seen from previous presentation, we need regulations, we have staff shortage, and we need more nurse lead programs. And in this short presentation, I hope to touch the task shifting and how task shifting could be help nurses in the specialist nurses in European healthcare towards 2030. And let's start to explaining what is task shifting. And the WHO definition of the 2008 the definition is the rational redistribution of tasks among health workforce teams. So it concerns the possibility of transferring skills from one professional to another, or to from a professional or to a caregiver or a patient, or to an innovative technological instrument. In fact, we have various types of task shifting as an increasing the depth of the job by extending the role or skills of a particular group of healthcare workers, or with the substitution or delegation of skills. We exchange one type of work from one profession to another group of professionists, breaking traditional professional divides. Or with task shifting, we also have the possibility to create of new skills, of the creation of the new skills, and so on. Why it is important to touch the task shifting project? Because with task shifting, we have the possibility to face staff shortage, to increase the skills of the staff, to increase collaboration between healthcare workers, to face the costs, but we have also the possibility to include better awareness in the management of disease by patients or caregivers. Some examples that we can report during COVID-19 are, for example, the body temperature control made by electronic instrument or by non-health personnel, or even the execution of swabs by pharmacists. We have, I could represent some results of past experience. Often with task shifting, we have the regularization of informal practice. And with task shifting has involved in recent years, which often see the regularization of practice already consolidated informally in various care settings that have led to some legislative changes in Belgium, Italy, Ireland, the Netherlands, and Scotland. And finally, I could report the recognition of the specialist family nurse in Italy last year. What's happening in Europe? In Europe, we have a project called TASCI. TASCI has been active since last year, which sees various European countries involved in, with the aim to study and evaluate task shifting in various settings, such as task shifting between family doctors and nurses in primary care, in mental health care, the use of telemedicine in a wound care setting, and task shifting in the field of ophthalmology. Some of the main results of TASCI will be a guidebook of task shifting, various case studies, set of the recommendation for task shifting actions, collection of useful tools and practice, and practical training materials and curriculum for task shifting. TASCI project involves 7 partners in various European countries, such as Italy, the Netherlands, Estonia, Norway, Lithuania, and Hungary. Hungary had the lead of the project. I could report some example, because I also want to report what I think represents strengths or weaknesses, threats or opportunities for nurses. Among the strengths is the push to work in a team, courses already available for same areas, and some activities are already performed informally by nurses. While among the traits, certainly some that we see also exposed in this slide, it may happen that there is no real recognition of the transfer of competencies. So in these 3 examples from Italy, we could see the situation of access vascular specialist nurses and echocardiographists nurses and wound care specialist nurses. So we can see that these specialist nurses are trained with 1 or 2 years postgraduate course. This course have a cost between 2,500 euros to 3,500 euros. And we can see that nurses now can formally implant peripherally central catheters, but they have more responsibility but the same salary. Or in the field of the echocardiography, nurses now do echocardiography, but informally, in an informal way. This is not recognized. Nurses can sign the report. Or in a wound care setting, often is not recognized because nurses can prescribe dressings. How task shifting is important to nurses towards 2030 and for the European Specialist Nurses Organization. I think, in my opinion, that Esno have to follow ongoing projects in Europe and insist on the recognition of skills already performed by nurses, but which are not formally recognized. And we have the possibility to propose new nurse-led projects, new specialization and training. Understand the regulation of the different European countries is important. So to understanding the consequences of task shifting and to understanding the barriers and facilitators of task shifting. And we have to push for the European certification of the different specialization and skills, and obviously made by the European Specialist Nurses Organization. And I really thank you for to give me the possibility of this presentation in this Congress.
Thank you so much, Luigi. We will move on to the next speaker, and if we still have time within this session, I will get back to you, Luigi, with perhaps 1 or 2 questions. So it's my pleasure then to introduce to you Dr. Alessandro Stevano, who is a professor, health professions, bachelor and master's degree courses at the University of Rome, Tor Vergata in Italy. He's the research coordinator at the Center of Excellence for Nursing Scholarship, OPI of Rome, and he's also a visiting professor at Boston College, United States of America. And Dr. Stevano is going to talk about the CESN program. Alessandro, I invite you.
Good afternoon, everybody. Thank you, Bert, and all colleagues who are listening to us. And this afternoon, I think I've shared my presentation, and this afternoon I'm talking about this proposal for the creation of the certification for the European specialist nurse. And this program is part of the development plan of the Esno, because if you have seen the presentation of Bear about the 5 pillars, it's well embedded in the first pillar of harmonization of different credentials and different practice activities of nurses in Europe. And this program is specifically aimed to advance specialist nurses among the different European countries, and we know because it was already underlined very well by Bert Omen that there are different legislation, and not all nurses can do the same things in different countries. And we have already seen with the previous presentation by Luigi Appuso, that in some cases nurses can prescribe. In other cases, as in the case of Italy or other countries, this power of prescription is not the case for nurses, unfortunately. But things are moving, and we have to move these things among the different European countries. So the partners of this project will be CGFNS International, that is a multinational, immigration neutral, non-profit global standard setting organization. It's a global recognized authority on the standards, education, credential evaluation of migrating nurses and healthcare professionals. And I would like to underline that in CGFNS has already collaborated with many organizations worldwide to develop these kind of programs. And particularly, CGFNS is collaborating with academic institutions, certification bodies, regulatory authorities, employers, healthcare systems, and over 45 years, this organization has served more than 3 million of healthcare professionals, and most of them are nurses. So we are partnering with this important organization to launch this project with this trusted partner, also for the security and data privacy. But what is it? This certification for European specialist nurse. This certification is based on some underpinnings, and these underpinnings are represented by nursing education, nursing licensure, registration if applicable, because we have seen that in different countries, there is an heterogeneity of this registration, nursing experience, professional reference, and on the professional nursing specialty organization. In our case, the EU specialty nurses organizations. And the purpose, the main purpose of this certification is to credential, to recognize those nurses who have acquired the education, training, skills, professional experience, and practice as specialist nurses at the European level. And this certificate will be awarded to those who apply, who voluntarily apply, and successfully meet the qualification framework criteria. You know, this could be the first step to have a professional recognition and also to facilitate, you know, the mobility and the recognition of these competencies in a wider Europe. And, you know, this recognition could provide the employer and the public with evidence that specialty nurses have attained a standardized higher level of competence. And, you know, this certification can provide nurses and specialist nurses in particular, because it's aimed for them with the impetus for continual education and professional development. So this certification for the European specialist nurse is an evidence-based portfolio assessment of education, credential, specialized nursing experience, and skills. This assessment represents Esno and CCFNS official recognition of the individual's evidence supporting their recognition, I mean the recognition of specialist nurses as clinical experts and professional nurse in a specific specialty area. This certification will be transferable across the nurse's career span and serve as the foundation for future career advancement and possibly as an improvement of cross-border healthcare and professional mobility for nurses with postgraduate training qualification. So these are the aims of our project, and who might be certified. A nurse that has met all the eligibility requirements as identified in the Certified European Specialist Nurse Framework and has submitted the evidence of achieving the requirements. So candidates must provide evidence of successful completion of a basic education in nursing and a recognized program in a related specialty, such as the different specialties that are embedded in the European Specialist Nurses Organization. But if you would like to have an in-depth look of the eligibility requirements, you know, these are some of our ideas to have these requirements for these specialist nurses if they would like to be voluntarily recognized as specialist nurses. At least 2 years of nursing practice in the area of specialization with a minimum of 1,500 practice hours in a specialty area. And the candidates must have an active and unrestricted nursing license or registration, if applicable, in the country of education or practice. Candidates must submit 2 professional references that certify the various competencies in the area of specialization, and candidates must be active members of professional organizations in the area of specialization. And we have also thought of a certificate for the certified European specialist nurses. And we really hope that this program can flourish in the next months and in the next years. And I would like to highlight that this program is very well embedded in the development plan and campaign of Esno for this decade till 2030. And we really hope that this program can be instrumental to have a wider recognition, a more stable recognition, also official recognition at wider level, and I mean at the European level among different countries. And I would be more than happy to answer to your questions about this program, and I would like to acknowledge all of you for listening. Thank you so much.
Thank you. Thank you so much, Alessandro and Luigi, for presenting two very important activities under the Esno's umbrella. I invite people, if they have questions, to post them via the chat or the Q&A area, since we need to move on to the next part of our program, which is the debates and discussion part.